Magandang araw po sa ating mga manonood ngayong hapon. Nandito po tayo ngayon upang makinig sa isang lay forum tungkol sa boses at pamamaos. Sa tuwing ika-16 ng Abril ng bawat taon ay ginugunita natin ang World Voice Day upang ipaalala sa atin na ang boses natin ay mahalaga at kailangan pangalagaan. Ang video na ito ay naglalayon na makatulong para sa ating dagdag kaalaman tungkol sa ating mga boses, mga problema ukol sa boses, at ang mga ginagawa ng mga doktor upang masolusyonan ang mga problemang ito para maagang malunasan o maiwasan ang mga komplikasyon nito. Hi Doc! Singer po ako sa isang bar sa Timog. 3 times a week ako nagigig, 2 hours per set. 2 set bawat gig po. Meron po akong problema sa pag-abot ng high notes at lagi sumasakit ang lalamunan ko pag kumakanta ako. Ano po ang dapat kong gawin, Doc?
So this patient, number one, was complaining of a voice problem only when he's singing. So the doctor needs to get details about the demands of his singing job. What types of songs does he sing? Is it rock? Is it pop? Did he have vocal training beforehand? Does he sing with a live band or with a -1? Does he have risky vices like smoking, drinking alcohol, or illegal drugs? Does he get enough sleep? What work does he do during the daytime? You can also get more details about the bar where he works. Is it a noisy bar? Do they allow smoking? Is it clean? Is it humid? Etc. When we do a laryngoscopy, we can see other conditions that affect the larynx. Does he have acid reflux? Does he have a beginning vocal fold nodule? However, it may also be that the vocal folds are completely normal, so this can then be referred for singing therapy.
When a singer complains of difficulty in singing high notes with pain in the throat area during singing, it is most likely explained by the vocal fold not stretching well enough to produce the high register note in the singer that the singer usually had. So the cricothyroid muscle is not working well enough to produce that stretch, and there is an interplay of other factors, just what like Dr. Hausen was mentioning. This may be due to the presence of an inflammation, infection, swelling, or just plain vocal fatigue. At this point, the strenuous vocal activity, the environment, and the vocal habits should be given due consideration. I would recommend that the singer undergo clinical singing voice rehabilitation or clinical singing voice therapy, which we offer at St. Luke's Voice and Swallowing Center. This particular therapy is customized to a particular singer's voice problem. It comprises 5 areas. 1. Practice of vocal hygiene. 2. Review of medical issues of the patient. 3. Looking into the emotional and psychological concerns of the patient. 4. Manage vocal pacing. And 5. Promote vocal conditioning and coordination through various vocal techniques, vocal and physical exercises, emphasizing the importance of vocal warm-ups and cool-down, as well as tackling on the bad vocal habit that the patient have. The goal of singing therapy is not only to provide strength, endurance, and flexibility of the voice, but also keeping in mind that the total well-being of the singer patient and also in empowering him or her to take care of her voice.
Intervention for the singing voice that usually performs in places like bars can be a bit tricky. There's a lot going on, and I want to understand where this performer's career is. What is he or she willing to undergo? Or how much does this person understand? Or how willing is this person willing to take up approaches of alter? What is this person willing to alter? What is this person willing to invest in? And bakit po? No? Bakit kailangan ng daming kailangan i-consider? There are a myriad of factors that come into play here. There's sleep, no, there's hydration. A singer almost always needs to compete over noise and music. There are noxious substances that the person inhales. There's stress related to the performance or stress that typically takes place beyond the performance. There's also the constant demand para bumirit. And sometimes there's also the worry of, no work, no income because there is no voice. And sa dami po ng factors, we haven't even touched even on the very simple things such as respiratory support in order to produce a big, powerful voice, nor have we checked laryngeal flexibility in order to attain a wide range. So the performing voice typically has a lot at stake, and more often than not, it's a question of how keenly does the person understand vocal endurance, and that preservation is the key to maintaining a successful singing career.
Hello, Doc. Nagtatrabaho ako sa call center. Graveyard shift po ako parate. Laging tuyo at masakit ang lalamunan ko, tapos on and off ang pamamaos ko. Bakit po ganyan, Doc?
So since this patient works in a call center during the graveyard shift, we immediately recognize that he will have several lifestyle habits that put his voice at risk. So the shift drastically affects the hours in which he can eat his meals. So he will have erratic meal times, he will eat a lot of junk food, and even totally miss some meals. So he will also have to take stimulants to keep him awake during the night, like coffee, energy drinks, or smoke. All of these harmful habits commonly lead to a condition called reflux laryngitis, a voice disorder that results from irritation and swelling of the vocal folds due to the backflow of stomach acid into the throat. And when we do a laryngoscopy, we can show these inflammatory changes in the throat area.
So for the call center voice, for the call center agent, there are many factors that contributes to your symptoms. First, the cold and dry air in your office. Second, most of the time you are in the sitting position, you're always seated. Third, coffee and cigarettes or lack of regular meal time. Fourth, lack of regular sleep. Fifth, strenuous vocal demand or activity, which is part of your job. So there is an interplay of factors which led to your symptoms. So the dryness in your throat, the pain in your throat, may be attributed to the cold and dry air in the office. The seat, you're all constantly sitting in sitting position. The coffee, the cigarettes, or lack of regular meal. Maybe yeah, I agree. Maybe is a contributory factor to reflux laryngitis. And so I would suggest to be consistent with practicing vocal hygiene, which is example is drinking or hydrate more, drinking sips of water between vocal activity or vocal pacing. Avoid or conserve your voice if you are in break time. Do vocal exercises, etc. Also, have your laryngeal checked to document a reflux problem and other vocal problems so that you will be treated accordingly.
From my work with several cases in this population, we're really talking about punishing work hours. Limitado lang po talaga yung mga water and bathroom breaks. Stressful customers calling in, working against the minutes to cram and close a client call, else penalize in call center agent and they lose points and be flagged for costing the company too much per call. Very cold workspaces, the food choices aren't very healthy, smoking in order to deal with pressures, etc. So I'm not really surprised po by the diagnoses, muscle tension dysphonia, laryngopharyngeal reflux. Personally po, I would really want to do a thorough assessment of this person, not just of the voice, but I would really want to understand what factors compound the voice problem, what are factors are within the person's control, no, and to what extent.
Doc, question lang po. Teacher po ako sa grade 2 to 6 students. Kahit online classes na handle ko, many times talaga namalat ang boses ko at tensed ang leeg ko, Doc.
So since the patient has mentioned specifically that she feels tension in her neck muscles, our first consideration here is muscle tension dysphonia or MTD. So voice change or generalized discomfort happens whenever she uses her voice, and the longer she uses her voice, then the discomfort gets worse. Uh, that is the most highly suggestive feature of this condition. Sometimes you can even feel tenderness when you touch the muscles surrounding her larynx. And there is narrowing of the soft tissue spaces between the thyroid cartilage and the hyoid bone, suggesting muscle tension as well. So during laryngoscopy, we can see that the structures above the vocal folds, which are not typically involved in voicing, are also squeezed in. So there is evidence of muscle activity in the supraglottic area or the area above the vocal folds. So there is supraglottic hyperfunction, or in common language, that's called the squeezing that we see.
So in this particular case, I would consider muscle tension dysphonia. Typical symptom in is dysphonia or malat ng boses with concomitant tension in the neck muscles. This dysphonia is considered a maladaptive pattern of voice production, resulting from a combination of poor vent support and unnecessary muscle tension. I agree that findings in laryngoscopy will give us evidence of supraglottic hyperfunction. The treatment here is conservative and includes practice of vocal hygiene like hydration, self-care, laryngeal behaviors, and vocal exercises, and voice therapy, which includes relaxation technique, breathing strategies, vocal function exercise, and circumlaryngeal massage if needed.
Online teachers who teach young students virtually suffer the greatest risk for muscle tension dysphonia. No matter how happy one is teaching children, it's always a totally different story when one is called to transform all classroom activities into virtual. I would typically start with environmental assessment, complete and down to the furniture and the work from home tools used. I would likewise want to work with a good physiotherapist, depending on what I see. Across all my muscle tension dysphonia clients, I see the greatest and most successful outcomes when we do interprofessional collaboration between me, a speech language pathologist, and a specialist visual therapist. We cannot possibly address muscle tension dysphonia at the laryngeal level alone. On my end, we need to deal with the entire system and reset it before we can deal with the smaller muscles.
Doc, nakita na may vocal fold nodule ako. On and off ang paos ko and nagho-hosting gig po ako. Paano yan? Kasi marami akong project na naka-line up.
Okay, so this patient comes in already with a diagnosis of vocal fold nodules from their previous doctor. So you explain to them that it is like having calluses on the vibrating edge of their vocal folds. So nagkakakalyo na yung vocal folds nila. So on laryngoscopy, we see bulges on both vocal fold edges where the vocal folds hit each other. So because of these calluses, the edges do not vibrate very well anymore, and they do not completely close anymore when you phonate. So this causes a rough or hoarse quality of the voice. So these vocal fold nodules start out as soft or immature. So the hoarseness may still be on and off, for which hopefully voice therapy can still have a therapeutic effect. However, with continued voice abuse and misuse, these nodules will eventually harden. And when we do a test called the video stroboscopy, we can already see that there is hardly any mucosal wave when the patient phonates. And when they close the vocal folds, there is a persistent hourglass uh, configuration in the glottis. So in these cases, where the voice is already, sorry, in these cases where the vocal fold nodule is already mature, the patient may need to opt for microlaryngeal surgery to solve her problem.
The primary treatment for vocal nodule is still voice therapy, but there are some patients who need surgery. So for these cases, we do our surgery in the operating room under general anesthesia. Here we place our instruments to the mouth, so there will be no skin incisions or any incisions to the neck. And we remove the nodule using cold knife, or we can also do this using laser surgery. But we also understand that there are some patients who are afraid of general anesthesia. No. So in this case, we can also do an injection of steroid to the vocal nodules. So we can perform this at the voice center under the guidance of our endoscopies.
In patients with vocal nodule, the speaking voice change the speaking voice changes are minimal unless the nodule is moderate in size. However, the singing voice is more like affected even if the nodule is small in size or just even a pre-nodular swelling. Treatment includes practice of vocal hygiene, hydration, moderate caffeine intake, control of reflux, optimizing vocal pacing. Vocal therapy or voice therapy is strongly recommended to help modify bad vocal behavior and promote vocal conditions and endurance.
Nodules have a nasty way of sticking around for as long as the phonatory behavior doesn't change. Kung hindi po nagbago ang paraan ng paggawa po ng boses ng tao, the nodules are going to stay. It might even worsen. The shearing and tearing forces po of the vocal folds using poor vocal technique add up and can either worsen the nodules or it might even compound to more complicated pathology. TV hosting uses a great deal of voice work to communicate drama, emotion, stress, in order to reflect what the person wishes to communicate. No TV host ever wants to have a hoarse voice because right away it takes away the acoustic credibility of how the person sounds. So there is no quick fix in working on vocal fold nodules. And the best way to work around these is via voice therapy. Even if the person does undergo minor surgery for vocal fold nodules, there is still the need to change the phonatory behavior. So, what about this host's lined up projects? Well, maybe this person and I would need to sit down and talk just so I can understand what compromises this person is willing to take.
My problem is my voice pag naghumili ako. May on and off tremor or nanginginig sa boses ko. Very unstable. Matagal na ito. Okay naman kung minsan. Nagiging conscious ako pag naghumili ako.
So in this case, the patient calls his voice nanginginig. So that's a very non-specific word description. So this time, we really need to listen to what the patient's voice quality is. So, of course, it can really be a tremor, a real tremor. Nanginginig talaga yung vocal fold when it vibrates, causing the tremulous voice quality. But there are other cases where the condition is actually spasmodic dysphonia. So when you say spasmodic dysphonia, the vocal fold is having involuntary spasms. So the voice tends to sound tight, strange, strained, or strangled. Ipit ang boses, parang ganon, no? So that is spasmodic dysphonia. So it's up to the doctor, the laryngologist, speech language pathologist, to recognize the condition based on the sound of the voice. So, in fact, even laryngoscopy may not help. They might look normal on laryngoscopy. It's really your ear that can diagnose spasmodic dysphonia. And for tremors, the laryngoscopy can help distinguish it from other kinds of dysphonia because you can see the tremor on the folds.
There are different ways to manage spasmodic dysphonia. We have a more conservative voice therapy, surgery, or even injection of Botox. Personally, I would prefer to refer this patient to our SLP colleagues again before doing anything. As mentioned, one treatment that we do is the injection of the Botox, or the botulinum toxin. It's the same Botox that we use for facial wrinkles. And these Botox block signals from the nerve to the muscles, causing spasms or the contractions of your vocal cord muscles. Typically, this would last for about 3 to 6 months, and the patient would come back for another injection.
This particular case seemed to be triggered by a stimulus, like during the homily of the patient. There is instability of voice, which is described to have tremor or nanginginig ang boses. It is important to know the etiology of this disorder, or it may be psychologic or neurologic in etiology. When treating tremor and the speaking voice, the therapy goal is to shorten the duration of phonation during speech to mask the tremor. Laryngoscopy is also recommended to further evaluate the patient.
I would take after what the doctor's approaches are to treating the priest's spasmodic dysphonia. Immediately, my questions would be, how long will the treatment effects last? What vocal patterns do we expect to come out as the effects fade? What can we do across the timeline that we can capitalize on relearning how to produce better vocal endurance and learn specific phonatory techniques that can possibly ride the tremors? How can we produce which phonemes that can mask the erratically disappearing phonatory qualities? Lots of experimenting when it comes to spasmodic dysphonia cases, and no two patients are alike when it comes to adopting certain approaches. So typically po, patients with this spasmodic dysphonia, they require constant support via voice therapy, not to mention understanding and identifying factors that worsen the tremors.
Ng araw, Dok, naoperahan po ang nanay ko dahil sa goiter nung 2 buwan nakalipas. Nahirapan magsalita, puro hangin lumalabas eh. Ayaw niya nang magsalita, Dok, kasi nahihirapan siya. Babalik pa ba boses niya, Dok?
Whenever we do thyroid surgery, one of the risks that the patient should know is that there might be an effect on her voice. So the nerve supplying the vocal fold is called the recurrent laryngeal nerve. It runs in the space under the thyroid gland on both sides of the neck. So surgeons need to take special care that this nerve remains intact when they do thyroid surgery, but there are times that despite all the care taken, injury can still happen to the nerve. And when this happens, the affected vocal fold will be paralyzed, and this condition can be seen and documented by laryngoscopy. So if the distance between the paralyzed cord and the moving cord is very near, then eventually the the moving cord will be able to compensate for the gap and the patient will have a voice. However, there are cases when the paralyzed cord is quite far from the midline, so the moving cord cannot compensate, resulting in a persistent gap when he tries to phonate. So the voice will unfortunately remain persistently breathy, and something has to be done to solve the problem.
Previously, these cases were only managed by an open neck surgery called the thyroplasty. No, it's an open neck surgery, meaning we create an incision to the neck and implant is placed to push the paralyzed vocal fold to the midline to lessen the glottic gap or the space. No? So this is performed in the operating room under IV sedation or local anesthesia. Well, currently there is an alternative, more immediate solution to a unilateral vocal cord paralysis or the unilateral vocal fold paralysis. No? We call it the transcutaneous injection laryngoplasty, and it can be performed in our center. This is an outpatient procedure done under local anesthesia where a filler substance like a hyaluronic acid is injected through the skin of the neck directly into the paralyzed vocal fold. Injecting to the paralyzed vocal fold will likewise push the vocal fold to the midline guided by the endoscope. No? The effect of this injection is immediate and will last for about 6 to 12 months.
So, the question is, babalik pa ba ang boses ko? So, babalik pa ba ang boses ng patient? I will give it 6 months wait for the voice to improve, with most likely just swelling in mind, but keep note of recurrent laryngeal nerve injury. I would suggest to start voice therapy after 8 weeks, just enough for the swelling to subside and heal, with the goal of voice therapy to maximize breath support and compensation technique for the vocal fold paralysis, and to restore voice to function.
Right off, I would immediately want to talk to the patient and put her anxieties at rest. I would say yes, she will be able to produce voice. Would her normal voice come back? We will know po. But it's important to work with patients with vocal fold paralysis right away, the soonest their doctor allows them to, before they even develop vocal misuse and poor phonatory patterns in their efforts to make their voice work for them. In other words po, bago maghanap ng ibang paraan ang pasyente para gumawa sila ng kanilang boses, sana po'y maagapan na po namin para matulungan po namin sila at magabayan po kung ano po talaga ang tamang paraan para mas makagawa ng mas mabuting boses. Would a person benefit from voice therapy? Yes, of course. Would I want this person to start voice therapy soon? Naturally, most especially if the person feels ready to relearn how to produce a better voice in spite of the paralysis.
Gusto ko ipakonsulta ang anak ko. Unti-unting nag-iiba ang boses niya. 13 years old na po siya na lalaki. Okay naman siya noon, mahilig sa basketball at nag-aaral. Pero nag-iba po ang boses niya. Parang ipit at laging hirap pang magsalita. Normal po ba ito?
Well, yes. We do expect changes to normally happen during puberty to a voice of a boy. So at birth, boys and girls have the same length of vocal folds, but they continue to grow as a child grows. The rate of change o yung bilis ng paghaba ng vocal fold ng lalaki ay mas mabilis kaysa sa babae. So, nagkakaroon ng mga mas obvious na mga crack, no? Yung na bibiyak-biyak yung boses nila, na mas madalas na pumipiyok ang lalaking binatilyo kaysa sa mga babae. So, not only the vocal folds are lengthening, but his entire larynx is also gaining mass. And we can see this because of the increasing prominence of his Adam's apple. So this is all due to the increase of testosterone during puberty, which leads to a lengthening of the cartilages and the vocal folds, as well as the thickening of the vocal folds. And the longer and thicker the vocal folds are, the lower is the pitch of the voice. So this child should know that the cracks are only temporary and they will stop when his larynx is finished growing. So this mom needs to be reassured as with the child.
The instability of pitch and loudness is typical in the adolescent voice. I would like to add that by the end of puberty, the larynx has developed 5 different layers, and these layers are still maturing during the adolescent stage. There is also a discrepancy in the strengthening of the interarytenoid muscles and the laryngeal cartilage growth, of which the lengthening of the muscles should catch up with the growth of the laryngeal cartilage, and this creates a triangular gap at the posterior level of the vocal fold, which contributes to the vocal change. Over time, normal exercise and maturation results in a much clearer and stable voice. Yes, this is considered normal for his age.
I would want to investigate the child's background even further and assess pitch and vocal intensity ranges. I'd ask for videos of their ball games to understand how the boy is using his voice, and maybe the boy is abusing unconsciously both on and off game. Peer influence on vocal pitch and use are potential factors as well. Marami po nangyayari po talaga sa buhay ng isang teenager at this stage wherein the voice does not just reflect on how this is used in daily life, also kung paano niya sinusubukang baguhin ang kanyang boses in order to be part of his barkada. All these matter at therapy, particularly how the teenager views or hears or regards his voice. After all, trying to use voice therapy to make this boy fit in a box of what normal voice might not always work. I take what the boy's concept of what his voice should be, and we can work from there.
Happy World Voice
Happy
Day!
World Voice Day!
Happy World Voice Day!
Happy World Voice Day!
Maraming salamat sa pakikinig sa ating Lay Forum. Naway may napulot tayo na impormasyon na makakatulong sa pag-alaga sa ating boses. Because your voice is your power.